Hello everyone, welcome back to my YouTube channel. This is Jane and this is Overseas Nursing Band. Thank you for joining me today. We'll be talking about use of honey for venous legs ulcers, marking venous leg ulcers today. That's what we'll be discussing. But first of all, welcome back to this channel and thank you for staying. Thank you for the new subscribers that have subscribed since now, and thank you to the old one that keep coming back. I appreciate you. It's because of you that I'm here. And please, if you have any questions or anything, don't forget to get in touch with me directly, and I would help you to the best of my ability. And I just want to say, how are you? Are you all right? All right, thank you. I hope you're taking care of yourself. You're preparing for your exams. What we do here is just to help overseas nurses coming to do nurse study to come and work as a registered nurse in UK. We help you progression, career progression, and all of those things, and help you especially with your Osce exams. I'll give you tips on how to pass your Osce exams. All right, from yeah. So today we'll be discussing the what we'll be talking about is in evidence-based practices, and we know this was introduced not long ago, so we now have evidence-based practice. And like I said, other ones that I've done, you don't need to it's just the marking criteria. It's very simple. I'm not going to give you a particular scenario, but just know that whatever scenario that you come across, this is what you'll be expected to give them in return. Okay, this is what you expected to give them in return. Remember that this is, what do I say, this is a silent 12 minutes station. So it's you, your pen, and as a rule of thumb, what I always say, write your name, your dates, and all those before you start, because you could be going on and you're writing and writing and you forget to put all of those things, and of course, you know, if you don't have it, it's invalid. And that is so hard when you've worked so hard, and just something as minute that you know your name or your initials or whatever is going to make you to lose marks. That's not good. Okay, anyway, so welcome back to my channel. Let's dive right into this, as they say. We'll be discussing the use of honey for venous leg ulcers. The use of honey, and you know, they'll give you a scenario, and when you've been given the scenario, and they will now ask you they also give you some research-based summary of some researches that I've done, and then ask you to make your conclusion with the scenario that I've given you. So whichever scenario you're given to, this is, and whatever research you'll be given to, this is what you have followed, because the research of the evidence of various research points to the answers they want, if that makes sense. Yeah. All right, so they're going to be asking you that, they say to you, summarize the main findings from the article summary and draws conclusion, making recommendation for practice. They've given you all the summaries, so they're now asking you that summarizes the main findings from the article summary and draws conclusion, making recommendation. That's what they expect from you. All right, so remember, like I said, don't use unnecessary abbreviation. If you don't know, just write in full. Like, don't do abbreviation, please. You know, text writing, and so don't do, cut it off. Make sure you write legibly so that the marker can read what you've written down, and then can give you the mark that you deserve. Please do like that. I promise you, if they can at least see what you've written, don't use unknown, your personal abbreviations. Don't do it, please. All right, so now they expect you say, I'll inform the patient that there's currently no conclusive evidence indicating that medical grade honey improves outcome for patients with chronic venous leg ulcers. Should I say it again? Number one, you will be informing, you say, I will inform the patient that there's currently no conclusive evidence indicating that the medical grade honey improves outcome for patients with chronic venous leg ulcers. Number one. Number two, you inform the patient, I will inform the patient that one large study found no reduction in size of ulcer or healing time with honey compared with standard treatment. Should I repeat it? Okay. I will inform the patient that one large study found no reduction in size of ulcer or healing time with honey compared with standard treatment. Another one, then you're going to be advising this patient now that in the same study, patient reported an increased rate of pain. So that's your advice. I will advise the patient that in this same study, patients reported an increased rate of pain. And then you'll also be advising this patient that another study has suggested that honey may have antimicrobial properties and may help patients with chronic venous leg ulcers who have methicillin-resistant Staphylococcus aureus, MRSA, infection. However, this was a very small study and more research is required on that subject. Okay, and you also been telling the patient, you inform the patient that there's no evidence that medical grade honey is cost effective in the treatment of chronic venous leg ulcers. So I will inform the, you'll be writing it down, dot, you make sure, remember their bullet points, no need to write essay, bullet point, 5 bullet points. Inform the patient that there is no evidence that medical grade honey is cost effective in the treatment of chronic venous leg ulcers. Then you will now be recommending to the patient, I will recommend that until further robust research is conducted and the efficacy of honey to treat chronic venous leg ulcer is established, the dressing of the wound should be based on current evidence trust protocol. So every trust have their own protocol. This, what you're doing is what your trust has recommended, has recommended. Simple. Given 1, 2, 3, 4, 5, 6 bullet points. Remember to base your answer on the summary, but whatever scenario you give, if you write down this answer that we've written now, you're good to go. You're very, very good to go. No problem at all. So like I always say, remember to date, sign, don't abbreviate. Please don't, please don't abbreviate. Okay? And I wish you all the best. So let me know which other one you want us to deal with. And I think probably we'll deal with 2 more evidence-based, and then we go over to professional values, and then we go over to A and E assessment, A to E assessment. But for now, thank you for watching. Remember to share, subscribe. Okay, thank you. God bless you. Bye.